back to Talk to Doc. I'm Maricel Laksa Pangilinan with Dr. Oyi Balburias.
Joining us now is Dr. Tina Tanbolyong. She's a pediatrician at the Medical City.
Hello, thanks for having me over.
Hi, Doc. We'd like to know, when is a child considered obese?
You're considered obese or overweight if you have exceeded the range for your body mass index. So we follow a certain reference prescribed by the WHO for the body mass index, which is the proportion for your weight to your height.
Okay, for example, you're 13 years old. How much should you weigh?
Ideally, you have to consult the chart as a reference. The normal range for your body mass index is from 18 to 25. So it's relative. It's really relative on how tall you are and how much you weigh.
So you cannot just say, oh, dapat ganito yung weight mo dahil ganito yung edad mo.
My objective measure.
Measure, yes.
So in adults, it's quite common, but how prevalent is obesity among children?
The Food and National Research Institute had a survey in 1998, and children from 10 years old and above, there is a prevalence of 1 to 3%. That was in the 90s. In the year 2003, the numbers doubled. And because it's increasingly alarming, because not just because the kids are heavier now, but they are already also reports of illnesses like hypertension in the young, pre-diabetic states. Those are the most common problems we have for this age group.
What are the primary reasons for a child to be obese?
Primary reason would be a lifestyle.
Diet.
A lifestyle. It's really a lifestyle. Portion of that is really genetic. Okay, but most commonly it is also lifestyle choices. So we are becoming more Western in our habits. So we have a lot of fast food,
Junk
junk food. Everything we like is more salty,
sugary,
more sweet, more oily, and we like to upsize too, much like
larger,
everything's larger now. So everything.
So parang,
you can.
nagsasalita si Doc, parang tumitingin siyang mga ganun, tsaka ganun. Alam na natin yun ng mga clues.
Yes.
Pag medyo salty yan, ham, medyo sugary, you know already, danger. Pag malalaking portions, ayan na. Nako, what do you say, Doc?
I think we need to ask more important question is, what can you suggest to address these lifestyle factors?
I think consciousness. Just be conscious. A good thing about having teens in our program is that they're more aware at this age. They know what they want and they want to do something about it. Much like our patients, like our first patient in the program, he really came to us to say that I want to do something about my weight problem.
But in terms of medical management or medical treatment, what are the available treatments, especially for kids like Miguel?
We do not really resort to medicine initially. We want to, as much as possible, not introduce the kids to medicine. That way you can avoid, start changing your lifestyle, your eating habits, you're getting yourself very active, out of your seat and into the
No computers and TV.
outdoors. So we get the kids out of the house and enjoy the sunlight.
Of course, these are adolescents, so you also need to deal with the parents. So would you say that parents are contributing factors why a child will become obese?
Oh yes. One thing, eating per se, and your activity is a social activity. So it's not just you having this problem, it's also addressing other factors that contribute to it. So it would strongly be recommended, especially for kids who want to deal with this problem, to engage their whole family.
Yes, when it's a family effort, then it's easier to manage.
Oh yeah, it's easier to lose weight when you know you have somebody who will be there to understand you and support you.
Kasi imagine you're trying to lose weight, tapos lahat ng masasarap nasa harap mo. Hirap naman.
Hirap talaga.
Yes.
Mahirap talaga.
And you mentioned kanina, Doc, diba, there are risk factors.
Yes.
Can you name them again?
A lot of these kids are already in their pre-diabetic state. So their insulin levels are up, though their blood sugar isn't. they can also experience hypertension this young. So imagine in their teens, they're already having high blood pressure when you think
so
na-
early.
So,
So you've had cases like that, like
Oh, yes.
early onset of medical conditions that you only expect during adult life, but
yes.
you're having them now.
Yes.
Okay, so Doc, in the case of Miguel, he lost 7 pounds.
Yes.
And then he improved his body mass index.
Yes.
How can then Miguel improve and maintain his weight loss?
The program encourages you to have a habit. So we encourage you to make healthy food choices. And this is already, in the 6-month program, we want you to reach for that goal, to get yourself out and be active, to exercise while you're with us. And this thing you should be carrying on even without us. So it's really just starting to create a habit.
Yeah, when I look at it kasi, 7 pounds in 6 months, that's not really much.
That's not much.
But what you're trying to develop are habits that he can keep for life.
Yes, he still has a goal to reach. And it doesn't necessarily have to be with us. We just need to jumpstart it. Then he can carry it on by himself. Anyway, we won't be always there with him. He needs to do things on his own. It cannot be that he's dependent on having us there.
So the core of the program is motivation.
Yes.
So it plays a big role in encouraging patients to improve on their health condition. And in Miguel's case, I think he's getting it from his family, right? And
Yes.
his friends. So personally, all the changes have been good for his self-esteem, would you say?
Yes, very, very confident, and he feels very proud of his achievement.
I'm sure he also enjoys getting dressed right now.
Yes.
Making paporma. I hope that Miguel's story inspires those struggling with weight loss, especially for kids and adults alike. We'll talk more about weight management in children, plus Dr. Tan Bolyong will also answer questions from our studio audience. Keep it here. Talk to Doc will be right back.